Could you please tell me a little bit about yourself, what you do, and some of your accomplishments?
Yeah, so I'm Devin Ridgley. I'm the Vice President of Biotechnology at H-Nu Photonics. And so what I do, or what we as a company do, is we specialize in developing research equipment for the International Space Station. So we are a NASA subcontractor that develops biotechnology equipment to operate in microgravity, to perform biology interrogations on the space station with mammalian cell cultures. So that's just a brief outline of myself and what our team does at H-Nu Photonics.
And then you guys did pair up or like work in conjunction with the BBC. Is that correct?
Yeah, we did. So right when the pandemic began in March timeframe, we were returning from a rocket launch in Virginia, Northrop Grumman rocket launch, and the pandemic broke out, and we were contacted by the Hawaii governor's office, who was contacted by the BBC to basically begin developing and building bridge ventilators and ventilators to help support the efforts of not only the U.S. government but also the Hawaii government, who's, as I'm sure you're aware, quite isolated from the rest of the U.S.
Yeah. Yeah, that sounds great. That's amazing how everyone could just like get on contact so quickly and we could reach out to you guys and then everyone was just willing to help because obviously this huge pandemic had hit us and no one really knew what to do. So it's great that like everyone could work together and then everyone responded really quickly.
Yeah, you're exactly right. And so the reason we began working with the BBC is because the Virgin Orbit group was working with the BBC, and that group had reached out to our governor's office and they asked if there's any space-based technology companies in the state of Hawaii, and we were the only one. And so they asked if we could start building or designing ventilators, and obviously we had never done that. That's
Yeah.
far beyond our specialty, but we said yes, we'd give it a try, and we did that, and we ended up building quite a few of them and developed them quite advanced.
Could I ask like why, like not bashing on Hawaii or anything, but like why did they specifically choose that area or like your team? Was that because you guys were already working with Virgin Orbit or was it like something very interesting that like they knew that they could go to you?
Yeah, so there's being Hawaii, there's not a whole lot of technology companies, and more specifically biotechnology companies, and we're one of very few in the state of Hawaii. And I think the initial reason they contacted us is because another space company was working with the BBC in Virgin Orbit, and we are actively participating with NASA subcontracts and in space
Oh,
type research. And so that was the immediate correlation for the state of Hawaii and the governor's office. Immediately we came to mind in that regard, and they contacted our CEO, Dan O'Connell, and we started discussions within our own team, started looking up designs through the BBC, as well as other open source designs online, and really hit the ground running and starting to develop and test bridge ventilators.
yeah, that's amazing. So then like could you kind of walk me through your process or maybe do you have a name of the ventilator that you created or did you
Yeah,
just
so we call it the ARC ventilator, and that goes for automated resuscitation compression system. And so we call it the ARC ventilator. And yeah, so the progression of design, testing, and development happened really rapidly in the very beginning. And this started, I want to say, early to mid March, is when we were contacted by the governor's office, as well as the mayor's office for the island of Maui, the county of Maui.
Mhm.
And so we started working on that. Sorry, those are emails. Um, and so from that contact to building our first 40 ventilators, uh, design, testing, fabricating, quality control was 6 weeks. And the first batch of ventilators was for the county of Maui in the island, which was obviously our highest priority and the most immediate need. And so we did use and leverage some designs from open concept sources, but I would say about 80% of our ventilator design is our own custom design that we basically designed other open source ones and
Mhm.
improved on significantly to achieve some of the variables that some of the physicians we were looking or working with and the BVC recommended we try to achieve.
Mhm. So you mentioned that it took about 6 weeks. Obviously, that's an incredibly short amount of time for like
Mhm.
considering what you had to do and all the testing, but also considering like the other kinds of work you guys do. Was that like something difficult that you guys had to step away from other projects to just work on this immediately, or did you have another team readily to like work on this to dedicate their time to this?
Yeah, that's a good point. So, immediately when the pandemic broke out, I think, our business and most businesses had to quickly pivot from their initial projects. So we did pivot away from some of our NASA developments at that moment, and we were happy to do it. Clearly there was a greater need,
Mhm.
and so this created a brand new challenge that none of us in our company had tried to achieve before. And so everyone was on board, and it was really quite impressive that the teamwork and collaboration that we displayed over those 6 weeks to develop the first version of these ARC ventilators.
Of course. And then, could you talk a little bit about like the current status of your ventilator? Are you guys still like manufacturing it? Was it kind of like a temporary thing? Like you guys just did it in the spur of the moment, and then like you guys are kind of finished or like stepped away from
Oh,
that right now?
that's a good question. So from that first version, the first batch of 40 units, we continued to develop and improve it. And so that one took 6 weeks. The latest version was about 6 months after that, and it's highly automated. We've improved it significantly. We're going through the FDA EUA process right now.
A lot of people
There's
want.
several interested parties, both domestic and internationally, interested in utilizing it during the pandemic and also post-pandemic.
Yeah.
What we've done is we've taken the basic concept of a bridge ventilator and advanced it to almost being able to replicate an actual ventilator.
Wow.
So we still use an ambu bag, but aside from that, most of the capabilities of a real ventilator we're able to achieve with our
So so it's not really a bridge ventilator anymore. It's basically like a full functioning ventilator.
it's nearing that point.
Okay. Yeah.
As long as we use the ambu bag, we'll never achieve a full ventilator,
Uh,
but it meets nearly all of the capabilities of a full ventilator. And based on the feedback that we've received from physicians across the U.S., they're very happy with how it's performing. And so we're going through the FDA EUA process, so we hope to get that finalized and get cleared for EUA use. Then we'll start to implement it in hospitals, both domestically and internationally.
And then you're mentioning like these international parties or like domestic parties. Could you like say who you're working with or who's like interested in working?
We have a bunch of hospitals as well as customers. Some are both. They're looking to do both projects as far as research projects, as well as buying the units. Unfortunately, I can't really mention who they are right
Yeah.
now
Uh-huh.
until we start to, um, they go through the purchasing process.
Mhm.
But we hope to get it out to people in need as soon as possible.
Mhm. Um, so how did these like your customers or like other people, how did they really hear about your ventilator? Like, was it just like by mouth or did you guys get some like publication done or something?
So we're working on a few research projects right now to that we will submit to peer review journals. But no, they haven't been published just yet. So it was mostly by word of mouth and our connections through the Hawaii government and then the Hawaii government
Yeah.
connection to other states and other international entities. And so obviously ventilation has been a need over the past year. So it comes up a lot. And when it does, people that know what we're doing reach out to us and then we get connected that way.
Mhm. And then do you see like after the pandemic is over and then we get through this, do you think that there's going to be like a larger demand for ventilators in general? Do you think that states and like other countries are in general are just going to stock up on ventilators?
Yeah, I think that's 100% the truth. I think this pandemic has demonstrated that there's a weakness in the chain of our healthcare system, and that is one of the main ones is these ventilators. The ventilators that are used throughout the hospitals are very sophisticated, but they're very complex and very expensive.
Mhm.
So there's a need for ventilators like ours that can be rapidly produced, easily deployable, and address 80 to 90% of respiration issues that occur within patients. And so that's domestically really, where it needs to be addressed. And certainly stockpiling per se may be required in certain states. Internationally, maybe a different issue.
Mhm.
Some countries may not have the facilities or the infrastructure to operate traditional ventilators,
Mhm.
and ours being relatively easy to use
Mhm.
and quite portable uh, is another use case for countries that don't have the facilities and the healthcare systems like we do in the U.S.
So talking about like internationally and then back to the EUA type thing,
Mhm.
if someone were to purchase your ventilator or use it outside of the States, would you guys have to go through another like process, like something that has to do with that specific country, like to pass through all of their requirements to use it in that country?
Yeah, that's a good question. It depends on the country.
Mhm.
Typically, the FDA EUA is accepted uh, for most countries. Now, there's obviously the European Union has their own regulatory process, but most countries will accept the FDA's decision as their own regulatory agency's type of decision.
Mhm.
But you're right; it is a unique process for each country that would purchase them.
Yeah. And then could you talk a little bit about like the EUA process and what it's like and like how you guys have been doing like with it? Because from other doctors and researchers, I've heard that it's like just a painful process, just a lot of paperwork.
There's a lot of paperwork. The FDA, for obvious reasons, has been very busy over the last year, and so it's really a practice in patience. They've been great working with us. We do our best to get them everything that they need as quickly as possible, and I know they're trying to do the same with us.
Yeah.
But unfortunately, because they're so busy, there's a lot of companies out there doing things that are required for this pandemic, and they've been busy, so it's been a bit of a long process.
Mhm.
But we're working through it. I think we're nearing the end of it, and we're hopeful to get through that process pretty soon.
Is there like maybe a website or somewhere where other people or the audience can go to look at your ventilator, like possibly if they just wanted to know more about it or like maybe purchase one in the future when it's available?
Yeah, so we're working on building that website right now. We have it in the stages, internally in our company where we could deploy it here relatively soon. Again, we want to make sure that our websites and all our flyers and things of that nature adhere to FDA regulations.
Mm.
So we've been waiting to clear the FDA EUA process to get that all up and running.
Mm.
But soon we will have something to where people can come and look at it, see how it operates, and certainly see the form factor and its capabilities, as well as purchase them if required.
Yeah, that sounds great. You did. I'm like, it's amazing how you guys can just throw something together like within a short amount of time and like how people came together really quickly and worked together. It's just like mind blowing what everyone can do and what everyone's willing to do.
Yeah, that's exactly right. I mean, this pandemic has been a crisis for everyone, and people tend to come together in times of crisis. So, our team is no exception to that. We have a very diverse team of engineers and scientists, and be it NASA biotech projects or COVID related pandemic issues, we have the expertise to be quite flexible in that regard.
Yeah. Do you have anything else to add? Any other questions or comments?
No, I think you pretty much addressed it all. We're excited to be able to get this, bridge ventilator or ventilator, for lack of a better word, to market, to help those in need. Hopefully, it's not needed as much, and this pandemic will be over soon. But we do realize that this is, it's a marathon. It's not a sprint,
Mhm.
and we're working to do our part and provide the help that we can,
Mhm.
those in need.
All right. Thank you so much.
Well, thank you. I appreciate it.